I think that awareness of liver disease and liver cancer is incredibly critical, especially now as we know that more and more patients are being diagnosed with liver disease. Liver disease is incredibly common both in Texas and throughout the country, particularly with fatty liver or MASLD being diagnosed more and more commonly and affecting up to 1 in 3 people.
Today's awareness for me means being informed, being advised, and being educated on what steps to take if you are not sure if you have liver cancer, because liver disease is not the same as liver cancer, but it is a factor into going into having liver cancer.
Events like this are very important for the reason that it helps raise awareness to the wider community affected by liver cancer. And I believe whether you have liver cancer or not, it's an important subject to touch on.
There's a lot of power in educating because you don't know what you don't know. Empowering people, it's encouraging them, and you're putting tools in their toolbox to where they can help themselves, but also, again, help others.
The reason that I'm involved in this is my husband Jimmy had HCC, and I was his full-time caregiver for the 2 years that we fought it. And I realized when he got it, how little that people knew about it, how little information there is, how little support there is.
But one of the physicians here today said it is very important to see a multidisciplinary team, which means so everyone there works together as a team to identify what that need is, and then across the board, you know what next steps to take, not just in your diagnosis, in your treatment, like what to drink, what to eat, and all those factors.
So I think our goal is really to spread the word about this as it can be treated if recognized early, and if left untreated can lead to complications including liver cancers.
I think it's important to have events like this in the community because it's a way of the people in the community to ask questions that they're sometimes fearful to ask, essentially to get a better understanding of things that they can actually do to really help their specific situations in terms of their outcomes, essentially.
Ask questions of the doctor. As far as that goes, ask questions, be an advocate, stand up for your person, and don't just assume that everything that they tell you is necessarily, 100%. If your gut tells you different, then ask questions and go see another doctor.
There's always more than one way to approach things, essentially, and I think one of the key takeaways here is that a lot of the patients that were here today essentially learned that it would truly benefit them to have not only just the physician they're seeing, but then also other physicians to weigh in on what they feel the best route of therapy would be for the patients, essentially, right? So we use the terminology multidisciplinary care, essentially having multiple eyes to kind of pull together a treatment strategy for the patient. And I think that was one of the biggest takeaways that I learned today, and I think the people here learned today, is that, if you're going to seek care, right, for your condition, to have a facility that actually promotes multiple physicians actually weighing in on which direction that we should take to make sure the patient can optimize their outcome.
My husband Jimmy said that he didn't let cancer beat him because he didn't quit living. And that's what he said, if you focus on the fact that you have cancer, HCC, you're dying, then you're letting cancer win because you're not living a life. Instead, he focused on that he was alive.